Are you taking the necessary steps to support your bone health? In today's video, we're diving into the top supplements for osteoporosis and bone health. Discover the key supplements you should consider and learn how they can make a difference. Are you ready to strengthen your bones? Welcome to Vitamins, your ultimate guide to holistic health and wellness, offering expert insights and practical tips for optimizing your well-being. Before we begin, it's important to share a quick medical disclaimer. The content we offer is for informational purposes only and should never replace the advice of a licensed healthcare professional. Consult your doctor for questions about vitamins, supplements, or medical conditions. Now let's get started. Osteoporosis is a condition where your bones become less dense because there's an imbalance between the breakdown and formation of bone tissue. It affects different parts of your bones like cortical bone, trabecular bone, and other structural components. The health of your bones depends on a process called bone remodeling, which is controlled by things like calcium levels in your blood and hormones like PTH, calcitonin, and vitamin D. Typically, people reach the highest bone density in early adulthood, and this is influenced by factors such as genetics, nutrition, and hormones. However, certain things can speed up bone loss and increase the risk of osteoporosis, like low estrogen levels, lack of physical activity, certain medications, and certain medical conditions. There are two main types of osteoporosis: postmenopausal osteoporosis, which happens after menopause due to decreased estrogen levels, and senile osteoporosis, which occurs in older people due to a gradual loss of osteoblast function. Osteoporosis often doesn't show any symptoms until a fracture happens, and the most common type of fracture is a compression fracture in the spine. Doctors can diagnose osteoporosis using a test called dual energy X-ray absorptiometry or DEXA, and if the T-score is negative 2.5 or lower, it means you have osteoporosis. Treatment options for osteoporosis include different medications like bisphosphonates, teriparatide, hydrochlorothiazide, denosumab, and raloxifene. It's really important to understand osteoporosis because it helps with early detection, prevention, and getting the right treatment. Osmosis is a great resource for learning about medical topics, including osteoporosis. It simplifies the complex concepts and provides educational materials for healthcare professionals and students. Alright, let's talk about the best supplements you can take for osteoporosis. These supplements can really make a difference in managing the condition. Here are the top ones you should know about. Let's dive into the first supplement, vitamin K. When it comes to osteoporosis, vitamin K is extremely crucial. It facilitates the use of calcium and vitamin D, both of which are crucial for maintaining healthy bones. Additionally, it has a direct impact on osteoblasts, which are bone-building cells. So, it's important to get adequate vitamin K. There are several types of vitamin K available right now. In the past, vegan or plant-based supplements often included vitamin K1. The problem is that our bodies can convert enough vitamin K1 into vitamin K2, which is more useful. Therefore, even if you consume a lot of vitamin K1, it won't result in enough vitamin K2. Because of this, it's advised to choose vitamin K2 as MK7 or menaquinone 7. The half-lives of other versions, including MK4, are shorter and need for more frequent dosage. 200 to 300 micrograms of vitamin K2 as MK7 should be your daily goal. It's important to remember that several research in animals and people have refuted worries about potential clotting dangers related to vitamin K intake. The only situation where this rule does not apply is if you are taking the drug Coumadin or warfarin. If that's the case, it's recommended to refrain from using vitamin K supplements and monitor your diet, particularly for vitamin K1. Ask your doctor about substitute drugs that aren't impacted by vitamin K intake. Most of the time, other drugs and vitamin K don't interact when taken in the appropriate amounts as a supplement. Now let's talk about calcium, which is a traditional osteoporosis suggestion. It's important to note, however, that you can often obtain enough calcium from your diet alone. Dairy products are a wonderful source, but if you have problems digesting them or absorbing them, you may need to take supplements. To ensure that your bones get the support they need, we often give additional calcium. For postmenopausal women, The recommended daily calcium intake ranges from 1,200 to 1,500 milligrams. However, make it a point to acquire your calcium from dietary sources whenever you can. The leftover quantity, which is typically 600 milligrams per day, may be supplemented. Avoid calcium carbonate when selecting a calcium supplement since the body has trouble absorbing it. Instead, seek for microcrystalline hydroxyapatite or MCHC, which is another name for calcium hydroxyapatite. In addition to calcium, MCHC also offers phosphorus and other necessary minerals. Additionally, it includes proteins, growth factors, and collagen, all of which are essential for healthy bones. Therefore, it's a bone supplement rather than merely a calcium supplement. Before we jump into the next part, we wanted to take a quick break and ask for your support. If you're finding this discussion on osteoporosis and supplements helpful, we'd love to hear from you in the comments below. Also, don't forget to subscribe to our channel to stay up to date with all our latest videos. Your comments and subscription mean the world to us, so thank you in advance for your engagement and support. Alright, let's get back to our chat about osteoporosis. Lastly, let's talk about vitamin D. Vitamin D is pretty cool because you can get it naturally from the sun. Your skin produces vitamin D when exposed to UV rays. But here's the thing, you may not be receiving enough natural vitamin D if you spend all of your time inside or covered up with clothing and sunscreen. Additionally, your body's production of vitamin D may be influenced by environmental variables including the season, time of day, and your location. You should thus get your vitamin D levels checked. We'll talk more about that in a moment. It's advised to receive between 15 and 20 minutes of sunshine in the morning and the evening when it comes to sun exposure. This maintains your circadian rhythm or internal clock in addition to assisting with vitamin D synthesis. But let's face it, most of us don't adhere to that regimen and often use sunscreen, which may actually prevent the absorption of vitamin D. It's possible to have low levels unless you are taking vitamin D supplements. When it comes to dietary supplements, it's recommended to choose vitamin D3, commonly known as cholecalciferol. It is vitamin D in its active form, which your body can readily absorb and use. Your body may actually absorb vitamin D supplements more effectively if you take them with food, particularly anything fatty. Now, without testing, determining the proper vitamin D intake might be a little difficult. It depends on a variety of elements, including where you start, how effectively your body absorbs it, how healthy your stomach is, how much vitamin K you have, and even your DNA. To play it safe if you're not getting tested, it's best to stick to doses below 5,000 international units of vitamin D per day. Testing your levels enables a more precise dosage modification, and some individuals may need larger doses of more than 10,000 international units each day. Always remember to speak with your doctor for advice tailored to your individual need. To recap, we discussed 3 important supplements for osteoporosis: vitamin K2, calcium, and vitamin D3. Vitamin K2 as MK7 is essential for bone health, while calcium supplementation may be necessary for those with dietary limitations. Vitamin D3 helps with calcium absorption and can be obtained from sunlight or supplements. Incorporating these supplements, along with a balanced diet and regular exercise, can support bone health and help manage osteoporosis. Remember to consult your healthcare professional for personalized advice and dosages. Together, let's prioritize our bone health and live our best, strongest lives. Now, we'd love to hear from you. What steps do you currently take to support your bone health? Unlock the path to a healthier you and join the conversation by sharing your thoughts in the comments below. As we wrap up, we can't stress enough the importance of vitamin D for bone health. If you're interested in learning more about vitamin D deficiencies and how they can impact our overall well-being, be sure to check out our video dedicated to that topic. Just click the link in the description to watch it. Don't forget to subscribe and click the notification icon to stay updated. Thanks for watching, and we'll see you on the journey to wellness.